So in this section we're going to cover data mining, part 3 related to epidemiology. The components of this review include morbidity and mortality, the leading causes of death, infant mortality rate, and health manpower, also known as access. So in this week's reading material and the videos that have been posted for you, you should be looking at the definitions of morbidity and mortality and having a good grasp on what those mean. But in the first part you're going to go to for the data mining for this section, you're going to go to the CDC Fast Stats. The link has been provided for you on the Blackboard under data mining resources. And here is just a snapshot of what you're going to find on the home page there. The number of deaths for leading causes of death. And this is in the United States, so probably no surprises here for you as practicing nurses that heart disease is number 1, followed by cancer, and then it drops off with accidents, chronic lower respiratory diseases, and so on and so forth. So this is a broad view and just good to understand what are the leading causes of death. As you dig deeper, you start to look at what is the mortality by age. Now, mortality is also cause of death. Okay, so those terms are used interchangeably on this website and in other readings that you'll find. But this actually is a table that breaks it down into mortality by age. So you look at the fact that in the years 2015 and 2016, they compared the death rates and they were fairly consistent in those two ages. By the way, the years of data, it's always going to be at least 2 years, sometimes 3 years behind, because it takes that long to get the official causes of death processed and into the CDC. So if you're looking for more current data, that oftentimes doesn't exist. But this should be no surprise in that there's more individuals die as they are older than versus when they are younger. Now, if we break it down into the age, race, ethnicity, and by sex or gender, you're going to see some disparities here. So in looking at the overall deaths in the deaths per 100,000 U.S. Population, you're going to see some averages there, but then you see that there are higher rates amongst certain populations. In the black male population is much, much higher than, for example, over on the right where you see the female Hispanic is significantly lower. And so you know this is important because in your population of interest, recall when the first data point you selected was the age, average age of your individuals, and then also average gender. And you should also be looking for any trends related to their race or ethnicity. So if your population has a high percentage of black males, then your outcomes for or looking for causes of death and mortality are going to be quite different than if you have a population with, say, white females. What if you do have a population of white female? Then you want to go and look specifically for what is the leading cause of death for white females of that age category. And on that website that is listed for you here, they give more specific details about the cause of mortality or death per age group. This is just another way of looking at the data, and this is the age-adjusted death rates for selected causes of death by sex. So again, here you have, there's um, the data range here is from 2006 to 2016. And if you're looking at the overall causes of death in these populations, you can kind of compare heart disease is for males the top leading cause, and for females, then that is also a high cause of death, not as high as for men. Cancer, again, um, it's very close for men and heart disease, but for women, cancer exceeds heart disease in this particular image. Then you go down and you look at unintentional injuries are actually at a higher rate for male than they are for female. However, stroke is higher for women. And um, diabetes is a problem for both populations. However, according to this, that one is not as much of a problem for females in terms of cause of death. So you can kind of think about the why that might be the case for various populations, and thinking about access for care and how they seek care, and that type of thing could be a contributing factor. But if you're looking for something to focus on for your population of interest, you want to first look at what is the age range of the most prevalent um, population in your community, and then by gender, and that should lead you to possibility of the leading cause of mortality in that particular community. Another very, very important measure that's used in health of communities is called the infant mortality rate. And to think about this, I think we're all born at the same place in terms of our health. You're probably not exposed to much else other than the maternal factors. It's really a indicator of maternal health is an infant's health. But then as soon as you're exposed to anything environmentally, then that changes and can contribute to cause of mortality. In this particular slide, I've got on the left are the US data. The number, the very low part says infant mortality rate is 5.90 deaths per 1,000 live births. And how does that compare to other nations? So this shows you data beginning in 1990 and here into 2017. And the children under 5 are the purple slide. The neonatal, the kind of the red area there, that's the one that would be comparative to our U.S. infant mortality rate. And you can see that according to this statistic, 18 deaths per 1,000 live births in the global community, as opposed to 5.9 in the US. So it's significantly lower in the US. And while they've made great strides to reduce that number internationally, there's obviously some more work to be done. But you will read about that and hear infant mortality rates is something that is measured pretty frequently. So morbidity is the second term that you'll want to be familiar with, and there's a short video clip in this week's material for you to review as well. But morbidity as a whole is refers to what causes illness in a population, and not necessarily leading to death, although morbidity and mortality can be closely linked. on the website that I provided for you, the same one that you look for the fast stats for the CDC, there's not a real easy way to find morbidity in your community, but I've provided some tips for you to search for that. So the first thing is you'll want to get to a page where it says Morbidity and Mortality Weekly Report. In the search engine up on the right hand side of the main page, you can just simply type in morbidity and you will see this. Actually, for those of you who are really interested in this, you can sign up for weekly reports to come to your inbox and they'll tell you about the MMWR. It comes every week, it tells you what's happening um, in terms of frequent causes of not only illness but death um, in um, the United States. But for this purpose, what you'd want to do is just type in the search for your particular community. And again, this is nationwide data, so you're not going to find any real specifics on your local community perhaps, but I've done some digging on your behalf and giving you some examples. The first one is since we do have a community in Colorado that you're exploring, here is something that came up on the MMWR, and that's morbidity in Colorado related to Colorado tick fever. This evidently is quite a bit of a risk out there, and they give you some symptoms and things like that, something to be aware of. But there are a number of articles related to that specifically. So again, that's something that you might be considering a possible health risk in Colorado, but I would do some digging for that specifically under morbidity. Another example here in contrast is morbidity in Indiana. So over here we've got cases of mumps that were associated with outbreaks at some universities, and this actually was from a couple years ago. So this shows you that what you're looking at is there were virtually no cases and then a lot of concentrated cases that ended up resolving at some summertime months. So that can be a huge, huge problem. And again, an example of morbidity in a community. Now, there's other examples of morbidity that you might think of that could lead to causes of illness. One could be, for example, obesity. We know that obesity is contributing to heart disease and a number of other health conditions. So you might check the status of obesity as a contributing factor in your community and determine if the rate of individuals with that condition, if there's a higher rate compared to other communities. You might also look for individuals with diabetes. Are there more individuals with diabetes in a community versus in another community? So all of these are examples of morbidity. Again, they might not lead to death immediately, or they could, but the takeaway here is that it's a little bit of a different measure of rate and a health of a community. The other piece of information that you should be gathering from this particular data mining exercise is known as health manpower or access. So a common theme of this class has been talking about access to care and how much people have access to various health resources. And so this, the site that you're going to go to is the healthandhumanservices.gov, and that again is a link on the resources that have been provided for you there on Blackboard. So when you click on there, you're going to see an image that looks like this, and you're going to click on Programs and Services, and then you're going to go and look at Providers and Facilities. And then in order to determine the providers and facilities in your community, you're going to click on an additional link there at the top that says Healthcare Providers and Facilities. And there's a spot where you can compare facilities. Now, you can look at hospitals. You can also look at other facilities depending upon the age group of your community. Hospitals is the common, but you might look at nursing homes and or other agencies as well. But you're going to click on hospital here for an example, and it's going to come up with a spot where you can find a hospital. Type in your zip code of your community of interest and hit the search button, and you're going to come up with the results. So as an example that I've been using for you in this class, I put in 52804, and I came up with 10 hospitals within 50 miles from the center of 52804. Now, those of you familiar with this particular community might say, well, wait a minute, are there 10 hospitals? If you delve deeper, there are 10 hospitals. They might be from the same 2 or perhaps 3 organizations, but they are indeed considered separate hospitals. And so from an access perspective, this is not appearing to be a problem accessing a hospital that's close by. If your results come up with very few hospitals within close proximity to your residence, then that could be a definite access issue. So in summary, what this particular data mining exercise is about is obtaining broad data based upon the state or the region. You're not likely to find a whole lot of detailed morbidity or mortality information localized to your community of interest. If you do, that's great. Sometimes a health department website will have more specific information, or a state health department will have some, but you're fine for this exercise to do it on a broad-based nationwide level. Then what you want to do is you want to compare it to other data, other states or regions. How does your group, your place compare in terms of access to care based upon hospital locations, and or how does yours compare to risks for morbidity or mortality? And then analyzing the data is going to be extremely important. At this point, this wraps up the data mining exercise. There's other data points that you may still consider gathering if you want and need more information, but you should be in a good place to start formulating your diagnoses. 3 of them is what's required for the assignment, and you do need to write them in the format that's provided for you on the Chapter 6 Community Assessment chapter that's located in your materials on the Blackboard site. And this is an example of how your diagnoses should be written. So if you have a community that you have an increased risk of whatever disease, I'm going to use obesity as or I'm going to use diabetes as an example. Increased risk of diabetes amongst the population in ABC community related to increased percent of the population with obesity as demonstrated in whatever percentage of obesity is present in that community. So you can take that same information and plug that in. Your diagnoses do not have to be related to a health condition in particular, though. They could be related to any other type of risks for injury, related to violence, if there's violence at that community, increased drug use, things of that nature. It could be an environmental issue, but it could be increased risk of uh, morbidity or mortality related to lack of access to health facilities. So that could be a diagnosis that you come up with based upon your findings from this week's data mining alone. And that completes this session. Please feel free to call me or email me if you have any questions whatsoever. You got a few more weeks left here and want to finish strong and help you out with anything that you need to put together your presentation.